All right, get ready to dive deep, everyone, because today we're exploring the world of parathyroid surgery.
Ooh, sounds intense.
It is, but specifically we're focusing on a condition you might not even be familiar with.
Okay, I'm intrigued.
It's called primary hyperparathyroidism.
Primary hyper... Say that 3 times fast.
Right. It's a mouthful. We'll just call it PHPT.
PHPT, much easier.
Way easier. So we've got this medical text all about it, and we're going to unpack all the key details about PHPT and its surgical treatment.
You know, it's interesting because this condition, it often flies under the radar. So many people don't even know they have it.
Yeah, that's what makes it kind of unnerving, right? Like you could be walking around with this thing and have no clue.
Exactly. It's often picked up accidentally, like during routine blood work.
So let's back up for a second for those just tuning in.
Sure.
What exactly is primary hyperparathyroidism?
Okay, so think of your parathyroid glands as tiny little calcium regulators in your body. They're key for keeping your bones strong and your nerves firing properly.
Okay, I'm with you.
In PHPT, one or more of these glands, they kind of go rogue, usually because of a benign tumor.
So they're like overachievers working overtime.
Exactly. Pumping out too much parathyroid hormone, PTH.
Ah, PTH, got it.
And all this excess PTH, it messes with your body's calcium balance, pulling way too much calcium from your bones and dumping it into your bloodstream.
Okay, so too much calcium in the blood, not good.
Not good at all. It can lead to a whole bunch of problems.
But you said it's often silent, so how do people even figure out they have this going on?
Usually it's through those routine blood tests. High calcium levels are a big red flag.
But are there ever any, like, tip-offs, symptoms that something's off?
Some people do experience symptoms, but they can be super vague, easy to miss.
Like what? Give me an example.
Think fatigue, you know, that brain fog feeling, maybe muscle weakness.
Oh, so stuff you can easily blame on stress or just getting older.
Exactly, and that's the tricky part.
You might not even realize it's PHPT until after you've had treatment.
It happens all the time. People say they feel so much better after surgery, but had no idea their symptoms were even related to their parathyroid.
That's wild.
It is.
So speaking of treatment, let's talk surgery.
Okay, well, let's get into it.
When is parathyroidectomy actually recommended?
So there are a few key scenarios, like if you've got clear-cut symptoms.
Like those kidney stones you mentioned earlier.
Exactly. Kidney stones, osteoporosis, even pancreatitis. Those are all signs that surgery is probably the best option.
Makes sense. But what about those people who don't have any noticeable symptoms?
That's where it gets interesting, because even if someone feels fine, surgery might still be recommended.
Wait, really? Even if they have no symptoms?
Yeah, especially for younger patients.
Younger, like how young are we talking?
Under 50, generally, because
Right.
they have more time to develop complications from PHPT down the road.
So it's like a preventative measure.
Exactly. Nip it in the bud before it becomes a bigger issue.
I see. So it's not just about how you feel right now, but also about preventing future problems.
Exactly. And even for folks over 50, if their calcium levels are really high or they have other risk factors like kidney problems, surgery might still be the best way to go.
Okay, so it's all about weighing the pros and cons for each individual case.
Absolutely. Personalized medicine at its finest.
All right, so we've got the symptomatic cases and the asymptomatic cases with certain risk factors. What other situations would call for surgery?
Well, sometimes PHPT comes back even after an initial surgery.
Like it just decides to reappear.
Yep. We call that persistent or recurrent PHPT.
Oh, wow.
And in those cases, a second surgery might be needed.
I bet those are a lot more complicated than the first surgery.
They can be much more complex.
And then there's a whole genetic component, right?
Right. Familial primary hyperparathyroidism, it's linked to certain genetic syndromes and often involves multiple parathyroid glands.
Oh, wow. So it's not just one troublemaker gland, it's a whole team.
Exactly. Makes the surgery more extensive.
Okay, so we've covered why someone might need parathyroid surgery.
The why, now for the how.
Exactly. Because I'm guessing there's not just one way to do it.
You're right. There are two main surgical approaches.
Hit me with them.
We've got bilateral neck exploration, which is the more traditional method.
Okay.
And then there's focused parathyroidectomy, a less invasive option.
So less invasive is usually better, right?
Generally, yeah, but it depends on the specific case.
Okay, so let's break those down, starting with the traditional approach. Bilateral neck exploration. Tell me about that.
So in bilateral neck exploration, the surgeon examines all 4 parathyroid glands to find the culprit, the one causing all the trouble.
Okay, so it's like a thorough search and destroy mission.
Pretty much, they want to make sure they address all potential sources of excess PTH.
Makes sense. Now, what about this focused approach?
Focused parathyroidectomy is like having a surgical GPS. They know exactly where they're going.
So it's less invasive, smaller incisions, quicker recovery.
Exactly. But it depends on accurate imaging beforehand to pinpoint the problematic gland.
So it's like high-tech treasure hunt in the neck.
I like that analogy, a treasure hunt for that one rogue gland.
But those things are tiny. How do surgeons make sure they've got the right one?
Ah, that's where the really cool technology comes in. We're talking intraoperative PTH monitoring and radio-guided parathyroidectomy.
Whoa, those sound pretty high-tech.
They are. They really help surgeons zero in on the right gland.
So walk me through those, starting with intraoperative PTH monitoring. What's that all about?
It's basically like having a live tracker during surgery. They take blood tests throughout the procedure to see if PTH levels are dropping.
So it's real-time feedback, letting them know they're on the right track.
Exactly. Confirmation that they're removing the right gland.
That's incredible. Now, what about radio-guided parathyroidectomy? How does that one work?
They inject a special radioactive tracer before surgery.
Radioactive sounds intense.
It is, but this tracer is absorbed by the overactive gland, making it light up on a special probe the surgeon uses during the operation.
So they can actually see the overactive.
Yeah, it's like having X-ray vision for parathyroid glands.
Wow. Talk about precision surgery.
It's amazing what technology can do.
It is. But, I have to ask, what happens when these parathyroid glands decide to play hide and seek?
Oh, you mean when they're not in their usual spot?
Yeah. What happens then?
It happens in rare cases. A gland might be in a totally unexpected location, like the chest.
The chest. That's pretty far from the neck.
It is, but it can happen.
So what do they do in those cases?
The surgeon has to rely on their knowledge of anatomy, become a bit of a detective to find that missing gland.
That's wild.
It is, but thankfully they have the skills and tools to handle even the most challenging cases.
Well, that's reassuring.
It is. The vast majority of these surgeries are successful.
So we've covered how they find these sometimes elusive glands.
Yep, we've gone over the why, the how. Now let's talk about the after.
The recovery.
Exactly, what happens after surgery.
All right, let's get into it. All right, so we left off talking about recovery. What happens after the surgery?
Yeah, let's get into that.
Because we've covered the why, the how, but I'm also curious, what actually goes down in the operating room?
Oh, it's fascinating. We always think about the surgeon and their skills,
Right.
but there's a whole team involved.
Oh, for sure.
And they operate with a very meticulous checklist.
A checklist. Are we talking pilots before takeoff?
Exactly. It all starts with informed consent.
Right, making sure the patient's on board, understands the risks.
Absolutely. They go through the patient's medical history, lab reports, imaging studies. It's all about gathering intel before they even make the first incision.
So like a pre-flight check, but for surgery.
Exactly. Got to make sure everything's in order.
And you mentioned PTH monitoring before.
Right.
That plays a role throughout the surgery too, right?
Absolutely. They take a baseline PTH level before they even start.
Ah, so they have a reference point.
Exactly. And then they compare that to readings they take during and after the procedure.
So they can see if those levels are dropping like they should.
Exactly. It's all about monitoring those levels in real time.
Okay, that makes sense. What else is on this checklist?
They also make sure there's an expert pathologist on hand
A pathologist, why?
to examine the tissue they remove in real time.
Ah, so they can confirm it's actually parathyroid tissue,
Right. They don't want to remove the wrong thing.
like a lymph node or something.
Exactly. Got to be absolutely sure.
Okay, so checklist done. What's next?
They prep the patient, give them anesthesia, and then position them very carefully.
Position them how?
Usually lying down with their necks slightly extended.
Okay.
Helps expose the surgical field.
Ah, so the surgeon has a clear view, like setting up the perfect shot.
Great analogy. Then the surgeon makes a small incision in the front of the neck, just a couple of centimeters long.
Minimally invasive, like we talked about.
Yep. And from there, they start carefully dissecting through layers of tissue to get to those parathyroid glands.
Sounds pretty delicate.
It is. It requires a lot of precision.
I bet.
They use very fine instruments, being mindful of all those vital structures in the neck.
Like nerves and blood vessels.
Exactly, especially the recurrent laryngeal nerve. That one controls the vocal cords.
Right. The one that could be affected and cause voice changes.
Exactly. They're very careful around that nerve.
So they're using both sight and touch to locate those glands.
Yep, and they follow a systematic approach.
It's not just random poking around.
No, not at all. They have a good idea where those glands usually are and where they might be hiding if they've gone rogue.
Okay, so they've found the suspect gland. What happens then?
That's when the real action starts.
Okay, tell me.
They carefully isolate the gland, making sure not to damage its blood supply.
Why is that important?
Well, sometimes they only remove part of the gland,
Okay.
so preserving that blood supply is crucial.
Got it. So they take a biopsy first.
Right, a small sample before they remove anything, send it for immediate analysis.
That's that rapid confirmation we talked about earlier.
Exactly, double checking they've got the right tissue.
Okay, and once they get the green light.
They either remove the whole gland or just a portion, depends on the situation.
I can only imagine how nerve-wracking this must be for the patient.
Absolutely. Communication between the surgeon and patient is so important.
Right, that trust, that transparency.
Absolutely. Key ingredients for a successful surgery.
Okay, so the gland is out, end of story.
Not quite yet. Remember that PTH monitoring we talked about?
The real-time progress report?
That's the one. So after removing the gland, they take another PTH level.
How long after?
About 5 to 10 minutes later.
Why the wait?
It takes a little time for those PTH levels to drop if they got the right gland.
So they're looking for a significant decrease in PTH.
Exactly. It's a good indicator of success.
But what if those levels don't drop like they're expecting?
Then it's time for a reassessment. Maybe there's another overactive gland hiding somewhere.
Or maybe they removed the wrong one.
That's possible too. It's not always a straightforward process.
Okay, so let's say everything goes perfectly, PTH levels plummet, success. What happens then?
Surgeon checks for any bleeding, makes sure that laryngeal nerve is safe and sound, and closes up the incision.
And then it's recovery time.
Exactly. Back to normal life, hopefully with those calcium levels back in check.
But we talked about those potential complications, right? Hematoma, hypocalcemia, nerve injury. What if those happen?
Well, a significant hematoma, that might require another surgery to drain it,
Oh, wow.
but it's not common. Hypocalcemia that's usually temporary can be managed with supplements,
Okay.
just until those remaining parathyroid glands get back in the groove.
It's like giving them a little boost.
Exactly. And nerve injury, that really depends on the severity. Sometimes it heals on its own. Other times it might need additional treatment.
Like voice therapy or even another surgery.
Yep. But thankfully, nerve injuries are rare.
Okay, good to know. So we've got the recovery process, the potential complications. But what about long term? Is this surgery considered a cure for PHBT?
For most people, yes. Once that overactive gland is out, calcium levels usually go back to normal, symptoms disappear. It's got a high success rate.
That's good news.
It is, but it's not like you just have the surgery and you're done.
What do you mean?
Regular checkups are still important.
To monitor those calcium levels.
Exactly. Make sure everything's running smoothly.
Okay, so we've covered so much. The basics of PHBT, the surgery, the recovery.
A lot of ground covered.
But I understand there's even more to talk about,
There is.
like alternative treatments, things besides surgery.
Absolutely. We'll get into those when we come back.
Okay, everyone, we're going to take a quick break, but stick around. We'll be back to uncover those alternative treatments for primary hyperparathyroidism. We're back and ready to wrap up our deep dive into the world of parathyroid surgery and PHPT.
You know, it's been quite a journey.
It has. We've explored the why, the how, and even those cases where those little parathyroid glands decide to go on an adventure.
They do like to hide sometimes.
They do, but before the break, you mentioned something that piqued my curiosity.
Oh, what's that?
You said there were alternative treatments for PHPT besides surgery.
Right. I did say that.
And I gotta admit, I was surprised because I thought surgery was pretty much the go-to solution.
It is the most common, for sure, but there are non-surgical options for certain cases.
Like when?
Well, for instance, if someone's not a good candidate for surgery, maybe they have other health issues.
Okay.
Or if the overactive gland is way deep in the chest, making surgery more complicated.
I see.
In those cases, ablation techniques can be a good alternative.
Ablation techniques. Now, those are new to me. What are those all about?
They're a pretty exciting development in the field.
Okay, I'm all ears.
There are two main types, angiographic ablation and ethanol ablation.
Okay, let's break those down, starting with angiographic ablation. What is that?
So imagine cutting off the blood supply to that overactive parathyroid gland.
Okay.
That's essentially what angiographic ablation does. They use a catheter to deliver a substance that blocks blood flow to the gland.
So it's like starving the gland.
Exactly. It shrinks and becomes inactive.
Wow, so they're shutting down the gland without actually removing it.
Precisely.
That's pretty impressive. Now, what about ethanol ablation? How's that one work?
So for ethanol ablation, they inject ethanol directly into the overactive gland.
Wait, ethanol like the alcohol?
Yep, that's the one.
Huh.
And they use ultrasound guidance to make sure they hit the right spot.
So it's a targeted injection that basically destroys the gland.
Well, damages it enough to reduce hormone production.
Ah, okay, got it.
Both angiographic and ethanol ablation have shown good results, especially for people who aren't good candidates for surgery.
That's fantastic. It gives people options.
It does. It's great to have more tools in the toolbox, so to speak.
For sure. But I got to ask, are there any downsides to these ablation techniques?
Well, it's important to remember that they're still relatively new.
Right.
They might not be appropriate for everyone, and while they can effectively control PHPT,
Right.
it's not always a permanent solution.
So the gland could become overactive again.
It's possible sometimes a repeat ablation might be needed.
And are there any risks or complications with these techniques?
With any medical procedure, there are always potential risks, but it's important to discuss those with your doctor.
Right. Make an informed decision.
Absolutely, a good conversation with your healthcare provider is key.
Well, it seems like we've reached the end of our deep dive. We've covered so much ground, from the basics of PHPT to all the treatment options, both surgical and non-surgical.
We've really explored it all.
We have, and I feel like I've learned so much about these tiny but powerful parathyroid glands.
They really are fascinating, aren't they?
They are, and it's amazing how much medical science has advanced in treating this condition.
It is. And the good news is that when those parathyroid glands act up, we've got ways to get things back on track.
Exactly. So for everyone listening, the key takeaway here is that even though PHPT can be sneaky and subtle, it's important to be aware of it.
Absolutely. Regular checkups and blood work are crucial. Early detection is key.
It is, and if treatment is recommended, whether it's surgery or one of those non-surgical approaches we talked about, know that there are options out there.
There are. Don't be afraid to advocate for yourself and ask your doctor questions.
Well said. Remember, everyone, stay proactive with your health, get those checkups, and keep those calcium levels in check.
That's great advice. Got to stay on top of those things.
All right, folks, that wraps up another fascinating episode of The Deep Dive. Thanks for joining us.
It's been a pleasure. Until next time, keep exploring and keep learning.
We'll see you next time for another deep dive into the world of health and medicine.